Hi everyone and welcome to my channel hube tabibi. This video of mine is about cold sores, also called as fever blisters. Well, these are common viral infections. They are tiny fluid-filled blisters on and around your lips. These blisters are often grouped together in patches. After the blisters break, a scab forms that can last several days. Cold sores usually heal in 2 to 3 weeks without leaving a scar. Cold sores spread from person to person by close contact such as kissing. They are usually caused by herpes simplex virus type 1 and less commonly by herpes simplex virus type 2. Both of these viruses can affect your mouth or genitals and can be spread by oral sex. Cold sores are contagious even if you do not see the sores. There is no cure for cold sores, but treatment can help manage outbreaks. Prescription antiviral pills or creams can help sores heal more quickly, and they may reduce the frequency, length, and severity of future outbreaks. Now, let me tell you the symptoms. A sore usually passes through several stages. The first stage is tingling and itching. Many people feel itching, burning, or tingling around the lips for a day or so before a small, hard, painful spot appears and blisters erupt. The second stage is of blisters. Small fluid-filled blisters typically erupt along the border of your lips. Sometimes they appear around the nose or cheeks or inside the mouth. Oozing and crusting. This is the third stage. The small blisters may merge and then burst, leaving shallow open sores that ooze and crust over. Signs and symptoms vary depending on whether this is your first outbreak or a recurrence. The first time you have a cold sore, symptoms may not start for up to 20 days after you were first exposed to the virus. The sores can last several days and the blisters can take 2 to 3 weeks to heal completely. Recurrences typically appear at the same spot each time and tend to be less severe than the first outbreak. In a first time outbreak, you may also experience fever, painful gums, sore throat, headache, muscle aches, swollen lymph nodes. Children under 5 years old may have cold sores inside their mouth, and these lesions are commonly mistaken for canker sores. Canker sores involve only the mucous membrane and are not caused by the herpes simplex virus. Cold sores generally clear up without treatment. You should see your doctor if you have a weakened immune system, or if the cold sores do not heal within 2 weeks, or if you have severe symptoms, or if you have frequent recurrences of the cold sores, or if you experience irritation in your eyes. Now let me tell you the causes. Cold sores are caused by certain strains of herpes simplex virus. Herpes simplex type 1 virus usually causes cold sores, and herpes simplex type 2 is usually responsible for genital herpes, but either type can spread to the face or genital through close contact such as kissing or oral sex. Shared eating utensils, razors, and towels might also spread herpes simplex virus type 1. Cold sores are most contagious when you have oozing blisters because the virus easily spreads through contact with infected body fluids. But you can spread the virus even if you do not have the blisters. Many people who are infected with the virus that causes cold sores never develop signs and symptoms. Once you have had an episode of herpes infection, the virus lies dormant in nerve cells in your skin and may emerge as another cold sore at the same place as before. Recurrence may be triggered by viral infection or fever, hormonal changes such as those related to menstruation, stress, fatigue, exposure to sunlight and wind, changes in the immune system, or injury to the skin. Now I'll tell you the risk factor. Almost everyone is at risk of cold sores. Most adults carry the virus that causes cold sores even if they have never had symptoms. You are most at risk of complication from the virus if you have a weakened immune system from conditions and treatments such as HIV or AIDS, atopic dermatitis, eczema. If you are suffering from atopic dermatitis, then this is a big risk factor for developing cold sores. Well, just few days back, I have already uploaded a video about atopic dermatitis, that is also known as eczema. That is very beneficial video and informative video. If you haven't seen this video, please see that video. Okay, that is available, and I will put the link in the I button also. Okay. Also, another risk factor is cancer chemotherapy. and if you are taking anti-rejection drugs for organ transplants. Okay, now I'll tell you the complications. In some people, the virus that causes cold sores can cause problem in other areas of the body, including fingertips. While both herpes simplex 1 and herpes simplex type 2 can spread to the finger, this type of infection is often referred to as herpes whitlow. Children who suck their thumbs may transfer the infection from their mouth to their thumbs. Eyes. The virus can sometimes cause eye infection. Repeated infection can cause scarring and injury, which may lead to vision problems or loss of vision. Widespread areas of skin. Some people who have a skin condition called atopic dermatitis are at a high risk of cold sores spreading all across their body. This can become a serious medical emergency. Okay. Now I'll tell you some preventive measures. Well, your doctor may prescribe an antiviral medication for you to take on a regular basis if you develop cold sores more than 9 times a year, or if you are at a high risk of serious complications. If sunlight seems to trigger your recurrences, apply sunblock to the spot where the cold sores tend to erupt. Or talk with your doctor about using an oral antiviral drugs as a preventive. You expect to be doing an activity that tends to trigger your condition, such as intense sunlight exposure. To help avoid spreading cold sores to other people or to other parts of the body, you might try some other precautionary measures, which I am going to tell you now. You should avoid kissing and skin contact with people while blisters are present. The virus spreads most easily when the blisters leak fluid. Avoid sharing items, utensils, towels, lip balm, and other personal items can spread the virus when blisters are present. Also, you should keep your hands clean. When you have a cold sore, wash your hands carefully before touching yourself and other people, especially babies. Now, I'll tell you the diagnosis. Okay, your doctor can usually diagnose cold sores just by looking at them. I mean, it's very simple to diagnose when the patients come to us. Also, when I am talking, I also upload images about this illness, so you can see those images and you can easily see how easy it is to diagnose these cold sores. Okay. Sometime to confirm the diagnosis, your doctor might take a sample from the blister for testing in a lab. Okay. Now I'll tell you the treatment. Cold sores generally clear up without treatment in 2 to 4 weeks. Several types of prescription antiviral medication may speed the healing process. Some examples of the drug medicine which I can give to you. Okay, the first is commonly used drug is this acyclovir that comes with the trade name of Zovirex. Then there are other medications such as valacyclovir that comes with the name of Valtrex, and another is famciclovir and panciclovir that comes with the name of Danavir. Some of these products are packaged as pills to be swallowed, others are cream to be applied to the sores several times a day. In general, the pills work better than the creams. For very severe conditions, some antiviral drugs can be given with an injection. Okay. Now I'll tell you some lifestyle and home remedies. The over-the-counter sore ointment and docosanol that comes with the name of Abriva may shorten the healing time of a cold sore. At the first sign of symptom, apply it to the affected skin as directed on the package. Use a cotton-tipped swab to put medicine on a cold sore. This helps prevent the spread of sores to the other parts of your body. To ease the discomfort of a cold sore, try other cold sores and remedies. Some over-the-counter preparations containing a drying agent such as alcohol that may speed healing. Use lip balms and creams. Protect your lips from the sun with a zinc oxide cream or lip balm with sunblock. If your lips become dry, apply a moisturizing cream. Apply a compress. A cold, damp cloth may reduce redness, help remove crusting, and promote healing. Or try a warm compress to the blister to ease pain. Rest and try pain reliever. Take over the counter pain reliever if you have a fever or the cold sore is painful. Creams with lidocaine or benzocaine may offer some pain relief. Now I'll tell you some alternative medicines. Although study results have been mixed, alternative medicine treatments for cold sores include lysine, that is an amino acid. Lysine is available as an oral supplement and as a cream. Rhubarb and sage. A cream combining rhubarb and sage may be about as effective as a acyclovir cream. Okay. Stress reduction. If your cold sores are triggered by stress, You might want to try relaxation techniques such as lemon balm extract, deep breathing exercises, and meditation. Well, on this channel with BB, there is a playlist of music therapy, and there's a trending playlist. And this playlist I usually upload some relaxing music videos and some ASMR videos that are very relaxing. You can see all those videos that can also help you to relax. Okay. And then there's another medicine that the name is propolis. This is also known as synthetic beeswax. This is available as 3% ointment. When applied early and often, it might shorten the duration of the breakout. Well, this was my video about cold sores. Okay, I hope you like this video. If you have any question about this illness, or if you are suffering from any illness for which there is no video available on this channel, you can ask me in the comment section, and if I get time, I'll try to upload a video about that particular illness as soon as possible. Okay, thanks for watching this video. See you in next video. Bye for now.